I'm here with former Majority Leader of the United States Senate, Bill Frist, to talk about Ebola. So, Bill, tell us what Ebola is exactly.
You know, there's a lot of misinformation out around the country, so I appreciate you starting with the basics. And Ebola is a virus, like the flu virus, in that it is cagey, it's smart, it's changing all the time. But big picture, think of it as just a virus that is contagious. It came out of Africa. The last big outbreak that killed a number of people was about 40 years ago, 1972. So a rare virus, but about every 30 years we see an outbreak like this.
Okay, how exactly did it get to the United States?
So the virus is in a central part of Africa, and generally it burns itself out. It might infect 100 people or 200 people or 300 people, but as long as they stay home and they don't infect other people, it just simmers away, dies away. And this time it grew from 100 people to 200 people to 1,000 people to 5,000 people to today 10,000 people have been infected. And somebody who got infected got on an airplane and flew about 15 hours, went from Africa up to Europe and Europe to the United States, and they were infected. And so the virus that is typically in Africa is now in the United States.
Okay, how can we stop the spread of this disease?
So, and it is a disease, and I think that's the key word when you say how do you stop the disease, because right now there's a lot of finger pointing and people are mad at doctors and nurses and airplane pilots and all that, but it's a disease just like the flu or smallpox or HIV/AIDS, so it's a virus. So we have to stop it by containing it and stopping the spread. And the best way to stop the spread is to have barriers. Like right now, if I were infected, you would not be getting infected now. Some way or another, I would have to get some kind of secretions either into your eye or into your mouth. But as long as we're just talking, so it's not all that infectious. So I tell most people just relax, not get too excited about it. But to stop it, to stop any kind of contact at all, so I wouldn't spread it to you, I have to have a barrier. So I would be wearing a mask typically. If I had a sputum or something on my hand, I shook your hand and you put it in your mouth, you might get infected. Therefore, people need to wash their hands. And you'll see on television the precautions, people will have gowns on when they're taking care of patients. But the big important thing is that it's not really all that infectious. It's not just like shaking hands and you're going to be infected yourself. Now, what's going to happen to it long term? There is no effective treatment for it. That's what's so bad about it. So out of the 10,000 people who have gotten the virus down in Africa, about 6,000 have died. So about 60% of the people who get it die because we have no treatment yet. So the big thing we need to do is prevent it. I predict what will happen is that in Africa it'll spread, continue to spread for a while, but just as it has every time in history, will eventually burn itself out. And in this country, there'll be a few people infected, but not a whole lot. And as long as they are separated and quarantined after 21 days, and you don't have the virus after 21 days, you're free to do anything you want to. So I don't think it's going to be very big in the United States. I don't think people have a lot to worry about here.
And tell me what this virus does to you.
Well, the virus, that's the scary part, because unlike the flu, the common flu virus, have you gotten your flu shot yet?
Yes.
Yeah, good. That's one thing everybody needs to do is get their flu shot. But this particular virus, instead of causing just the flu with joint aches and pains and a fever, this particular virus, if you get infected, takes 21 days, what's called the incubation period, and you're asymptomatic. You don't have symptoms. You feel good. Then at 21 days, unfortunately, it causes a bleeding disorder. So all your blood gets really thin, and it's called hemorrhagic or hemorrhaging disorder. And therefore, people bleed into the internal organs and they die. So it's a terrible death. Not everybody dies. In this country, probably 30% of the people would die who got infected. So the big thing is to prevent the infection itself.
How long does it take for somebody to die?
Well, it goes pretty quickly. So if you get the virus, it takes 21 days for it to sort of grow and then cause fever and cause joint aches. And the people generally will die within 2 to 3 weeks after that.
What precautions can we take to prevent
Great question. First of all, the typical person, I'm not worried about it, and you shouldn't be worried about it. If there's an infected patient that you come in contact with, then you need to be concerned about it. If you know you're going to be taking care of that patient, say if you're a nurse or a doctor, you want to be washing your hands, as we said, have a mask on, you'll have a hood, because you don't want any of their body secretions at all to be able to infect other people. So what I'm telling people is, first of all, get a flu shot. 23,000 people are going to die of the flu this year. 23,000 this year are going to die of the flu. Of Ebola in the United States, hopefully 4 or 5 will. So we don't have that much to worry about here. So I say get a flu shot, wash your hands regularly, and if there's anybody in your community who has Ebola that you know of, then take those extra precautions of staying away, because the virus can't travel very far. It can only travel from me to you through body secretion. So if you're not in touch with them, you don't have anything to worry about in terms of Ebola.
Last question. If you could talk to every American in the United States face to face, what would you tell them?
Great question. So if right now, somebody said, what would you tell the average person? Number one, Ebola demonstrates the importance of all of us investing further in global health. Right now, the American taxpayer thinks we spend a lot of money on foreign aid and on global health. And in truth, we spend less than 1/10 of 1% of our whole federal budget. If we'd spent more in the past. So it's an argument for investing in public health around the world, and that's called global public health. Number two, you don't have anything to worry about in your community. The communities like Dallas, where there is a patient, you need to make sure that patient is quarantined, but as long as they're quarantined, you have nothing to worry about. And number three, I would say, I would hope the news media and others would, first of all, learn the facts. And then number two, stop pointing fingers. Stop pointing fingers at the head of the CDC or the politicians or the nurses or the hospital itself, because we all need to band together to fight the disease itself. Not just here, but in Africa. Again, not that much to worry about, but take those precautions, get a flu shot, wash your hands as often as you can, and we're going to be okay here in America.
Thank you.
Thank you so much. I appreciate it. Thank you.